Hi, everyone. Welcome to today's webinar called Engaging Revolution. Health Payers Panel shares leveraging data to increase pharmacy consumer engagement and measurable outcomes. Thank you so much for joining us today. My name is Jenny Burke. I'm the Vice President of Regulated Market Operations and Oversight at Express Scripts by Evernorth. I'm also a co-lead and member of NCPDP's Health Plan Subcommittee, and I'm excited to be hosting today's webinar. To all of our NCPDP members and previous webinar guests in attendance, thank you for being here and joining us today. And if this is your first time joining an NCPDP webinar, welcome. We're excited to have you join us today. I'll just take a moment to cover a brief update about NCPDP being a not-for-profit, ANSI-accredited standards development organization. Our focus is on transforming healthcare through standards that improve access, safety, and outcomes. Our membership is so diverse, consisting of payers, pharmacies, vendors, manufacturers, and many other stakeholders across the healthcare ecosystem. And we work hard to create consensus-driven solutions and positive change. If you're interested in joining our work, check out NCPDP's website, as we're always looking for new energy and ideas to help keep moving us forward. Now, back to the reason you're all here today. This is an important webinar for NCPDP, as over the past year, we've been focused on health plan engagement. NCPDP recognizes the critical role that health plans play in the future of pharmacy and healthcare. This is why we've created a special health plan subcommittee, establishing a forum to better understand health plan needs. And today, we've gathered some industry experts for a panel discussion, moderated by Melissa Meyerowitz of RxEngagement. They plan to share some real-world examples of data-driven strategies that improve pharmacy communications, governance, achieving a 40% boost in consumer engagement and improved measurable outcomes. So now let's meet our moderator. Melissa Meyerowitz is a partner at RxEngagement, a healthcare consumer engagement agency and consultancy that works with payers, PBMs, condition management companies, and health tech firms that are looking to drive greater outcomes. Having worked in various leadership roles across healthcare, technology, and consulting entities, Melissa's dynamic career includes spearheading successful marketing and business development programs nationally, as well as analyzing business opportunities based on market needs and short and long-range organizational priorities. She develops appropriate solutions and go-to-market initiatives based upon analysis of the buyer's business needs, combining expertise in strategic market planning, organizational leadership, and project management, with a strong background in new product and service development and market launch. At RxEngagement, Melissa works with both health plan payer and health technology clients. Hi, Melissa, and welcome.
Thank you, Jenny. Thanks, everyone, and welcome to everyone who joined today's webinar. We are very excited for you all to be here for this dynamic conversation, and we have a lot to cover, as Jenny said. We've got a great panel ahead. I just do have to cover off on a few quick reminders before we dive in. All of your phone lines are muted during this webinar to limit background noise. And you should feel free to ask questions, though, at any time. And you can use the little Q&A box that you have at the bottom to do that. So we have set aside some dedicated time at the end of our discussion today to actually answer all those questions. But don't feel like you have to wait until the end. Please feel free to drop questions into that box, and we'll go ahead and field them all at the end. And then if anyone is wondering, NCPDP is going to send out a video replay of this webinar today, and you'll receive that within about 5 business days following the close of today's session. So with that out of the way, let's go ahead and just meet our distinguished panelists. So first, I will introduce Mara Mitchell. Mara is the Vice President of Pharmacy at Oscar Health. Oscar is a health insurance company whose mission is to make a healthier life accessible and affordable for all. So Oscar really focuses on providing health insurance coverage through the ACA marketplaces and offering plans that cater to individuals and families who are purchasing insurance independently. And that's important for today's panel to keep in mind. We're going to have 2 different vantage points of the industry, and Mara's going to come to the table here looking at it from that ACA and individual lens. In her role at Oscar, Mara is responsible for the pharmacy clinical operations and management of the key delegate vendor partners, providing core services that support their prescription benefit offerings. But prior to joining Oscar, Mara did hold leadership positions and operational roles at PBMs and pharmacies. She has also served as a consultant, providing expert advisory services to healthcare clients, including pharmaceutical manufacturers, industry trade organizations, PBMs, pharmacies, and health plans. And then in addition to her role at Oscar, Mara is a member of WBL and serves as a board member of the NCPDP Foundation and a board member of NCPDP. She held the position of chair actually from 2023 to 2024. And then in addition to her board service, Mara has held various leadership positions serving the NCPDP membership, such as chair of Strategic Planning Committee, Finance Committee, and Bylaws Committee, as well as co-chair of Workgroup 11, e-prescribing and related transactions, and of Workgroup 14, long-term post-acute care, and as a member of numerous committees and task groups. So welcome, Mara. Thank you so much for being here today and taking some time out of that busy schedule. Next up, I would like to introduce you all to Melinda Nelhubel. Melinda is a seasoned leader in the healthcare industry. She is currently serving as the Senior Director of Pharmacy Operations at Blue Cross Blue Shield of Massachusetts. And in her current role, Melinda is responsible for overseeing Medicare formulary and administration, Part D stars and clinical programs, commercial and Medicare pharmacy utilization management, and pharmacy provider partnerships. So you can see, again, we're going to get a great perspective now from another segment within the market today, thanks to having both of these panelists on board and these sort of unique vantage points they have in their plans. Melinda is passionate about striving for operational excellence, improving Medicare Part D outcomes, and fostering the growth and development of her team. She has also held various roles, including Senior Product Manager for the New England Joint Enterprise Medicare Part D Standalone Plan, and Client Engagement Director at Prime Therapeutics, where she supported Blue Cross Blue Shield of Rhode Island in both commercial and health insurance marketplace segments. So thank you, Melinda, for taking the time out of your busy schedule to be here today. And before we just start jumping right into some Q&A with the panel, I just want to take a moment to share a quick overview of what we're going to be talking about today. So as Jenny spoke about earlier, we're going to be sharing some real-world examples of data-driven strategies that have improved pharmacy outcomes. And I'm going to be prompting our panelists to respond to a few questions so that they can really dive deep into their personal experiences within their organizations. So with that, go ahead and start here, and I'll launch my first question. So my first question for the panelists: there has been a lot of disruption in the PBM space as of late. That might be an understatement if you've been following the headlines. I'm curious how you are both organizing your pharmacy programs today. Are you using point solutions and targeted technology at all? And if yes, how are you using them and how are they integrated into the fold? So let's start there. And Melinda, let's start with you, if you don't mind, in hearing a little bit about your experience.
Sure. Thank you, Melissa. So I'm going to focus on Part D for medication adherence and MTM. So we were empowered by our leadership to really think big in the last 18 months. And so that led us to the question of, for Part D clinical measures in MTM, we're fully delegated with our PBM. And, besides our rigorous oversight we provide, what else could we influence? So I started to think about what could we do differently? So over the years, we had done some smaller outreach campaigns with not a lot of success in terms of, just calling off the side of our desks and just not having a really sort of strategic plan on how to do that. And it was really not useful in the sense that we weren't getting the data or anything back from why, members weren't filling their medications. It was kind of one of those things that when we came up every year, our teams would roll our eyes and we're like, all right, we're going to just figure it out. We'll do it. So, we started with the thought of our mission right here at Blue Cross, which is to show up for everyone like they're the only one, and taking our value of being curious and being courageous to say, let's start asking questions. Let's start making those big ideas real. And when we were asking ourselves these questions of, how can we improve our outcomes, it really came down to we needed to align ourselves with vendors who shared our values as well as our passion on member experience. So it started with working with Engageus first. We had the pleasure of working with them on a small pilot. It was about 6 weeks at the end of the year in 2023. And we were able to quickly mobilize, come up with a framework and milestones and barrier breaking messages to influence adherence in the fourth quarter, because that's the red zone for us in pharmacy. So that pilot then gave us the data of our pain points, and we worked together to find out that we were having difficulty converting complex, non-adherent members. The outreach strategies the PBM were doing on their own was limited, and we were outperforming them in that small pilot we were doing, and essentially showed a lack of customization, the communications, which we were quickly realizing was the barrier to us being successful. So we took that pilot and we worked with Engages to build a new team, have an implementation plan, and we were able to basically build it, create it, and lift off within 6 months. And so that team is a team I'm going to talk a lot about. It's the Medicare Clinical Program Team. We call it MCP. And basically that is the hub of our Part D oversight and our outreach campaigns in conjunction with the PBM. So we're making outreach and we're completing MTMs, and then we're using all of that data to be able to make better outcomes. So then one of the things that came out of that was working with another vendor too, which is MyMeds. We had been working with them, and it quickly became apparent that it was the missing link to basically making the Medicare clinical program as effective as it could be. We were working off spreadsheets. We were trying to update data that was over 2 weeks old. And MyMeds, the platform, gave us the opportunity to get actionable insights that we could monitor and adapt into real time, gave us the ability to make on-the-fly changes and create action plans quickly. People weren't, grabbing the same members at the same time. That's the program on their platform. There's this amazing ability to have everything be daily targeted member prioritization. So we're knowing exactly who we need to call at that moment, at that time, so people aren't becoming non-adherent and unrecoverable. So being able to have all that data at our fingertips, and then also being able to enter all the outcomes that we were getting from the members and all the data from them in terms of like why they have barriers, who we were talking to, things that we could then log in the future, just create this mass efficiency that, we were expecting to start on 1/1 of 2025, but it gave us the ability to start really quickly and influence what we think, the decline in quarter4 shrinking by using MyMeds. So they were a huge partner. And then the last one we used was Curant. And they basically are, again, another vendor that shares our values in terms of experience. And they use actionable insights to make outreach. They have a multidisciplinary team. And so just both vendors have been really great at working with us and collaborating and showing us like what we can do when we think big, which again is what our original goal was.
That's amazing. So vendor collaboration, data inputs in closer to real time so that you can make quick interventions and really pivot and really work faster to target, the right folks at the right time, which is fantastic. No lag time, which is great.
No, none. It's great.
Thank you so much, Melinda. And Mara, do you want to talk a little bit about your own experiences?
Yeah, so at Oscar, we utilize some of the more standard solutions that you would expect. We have formulary management programs. We do our best to encourage 90-day utilization where it's appropriate to make sure that members are accessing their care, your specialty management programs. But we also have some unique things that we do in helping identify when there are members with gaps in care and assist them in seeking care. Oscar actually has our own virtual care unit called Oscar Medical Group. We offer virtual urgent care, and then in a handful of states, we also are offering virtual primary care. And so through that, we're able to very quickly help members engage with care, even if they don't necessarily have an establishment with a provider, particularly in the ACA space where you have new members joining your plan every year and actually every month, as members have special election periods and things like that allow them to now qualify to join the plan. And then we also look at some of our chronic disease management tools, including focus plans. And we launched something this year called WellDia, which is a diabetes management program designed to make care more affordable, accessible, and integrated for our members. We focused on this because nearly 10% of our members are living with diabetes. And so through the WellDia program, they get $0 test strips, Lancept, a glucometer. There's personalized support for high-risk members, and they have that 24/7 virtual urgent care for immediate needs. So particularly when somebody's more newly diagnosed or has some change in what's happening with them, it allows us to complement our health plans by offering that streamlined and holistic approach to diabetes care. So that's just a couple of examples of ways that Oscar is looking at this.
That's great. Thank you, Mara. And I know in your example, Mara, some of those technologies are not necessarily from outsourced third parties. Is that right? They're actually homegrown solutions?
Yeah, that's correct. Oscar really prides itself on being a tech forward. So depending which part of the organization you fall on Oscar, somebody might actually refer to themselves as a health tech versus health plan. We have a very strong engineering team, and we've designed a lot of our own tech, our own medical claims management processing system. Our Oscar Medical Group actually uses our own EHR platform, which has allowed us to custom tailor integration, particularly since those members are captive to Oscar Health Plan. So our technology, and I'll talk a little bit later about some of the other technology that Oscar uses through our campaign builder tool, and how we also make those connections, which is all Oscar homegrown tech.
That's great. So another great example, though, of being able to use data to make better decisions in a faster time frame, for sure. So thank you both. I'm going to move on to our next question, which is, we at Engages have been talking a lot with our clients recently around orchestration. And from our perspective, orchestration really means, how do you balance the objectives of the pharmacy or your PBM team with the broader or grander communications or outreach efforts that the plan may have as a whole? We know from our work with a lot of our focus groups and other clients that most health plan members struggle to make the distinction, or just don't make any distinction, between the pharmacy and the PBM and their health plan. It is all just sort of one entity to them in many cases. And so they may just be experiencing as a member a lot of phone calls or a lot of mail or a lot of both, and emails and text messages. And it may not all feel super relevant to them. And so I would love to hear how both of you have been collaborating a little bit more across your enterprises with different folks within the organization. And so Melinda, we'll start with you there.
Sure. Yeah. So, I mean, it's exactly it, right? The members are receiving a lot of calls from their doctors, their pharmacies, and other teams within Blue Cross. And so historically, in pharmacy, all of the calls were delegated to CVS, and we weren't making any calls for adherence. So that's changed. So now with the Medicare clinical program team, we're the captain or the owner, right, of the Part D clinical measures. So now we are interfacing with these teams in a different way. We would support, obviously, questions that people would have about pharmacy within the areas, but now we are, side by side. So we're looking at, are there opportunities where members who have multiple gaps, if they have adherence gaps, we're able to support that team and say, okay, well, we can make those calls too. We can take your script and we can help make some of those calls. Or what we're doing a lot is around like referrals. So basically, when a member calls in and has a lot of these questions, is that we're really working with the member service teams or the engagement teams to say, like, if you're hearing something, like, let's get them connected, right? And so the member is getting connected proactively to somebody. So we're not making always just like cold calls to them. So we're building that relationship, bringing that sort of trusted ally piece of it by getting the member when they're ready to have conversations about these things versus just cold calling them. And I would say the other thing too is just thinking about, how we're using MyMeds and how we're targeting the population, but also, thinking about when we're building communications, that we're bringing members right into pharmacy in those communications. So they're not calling member service with follow-up questions, or they're not calling case management with questions. We're bringing them right to the Medicare pharmacy team. And we've had a lot of really positive feedback that when a member calls from a letter that we've sent, like, we got you the first time, you just picked up the phone, like, that's amazing. So changing that and being that hub and being that centralization, I feel like is working for us. And we now are building that reputation across the organization that we can help assist in other engagement campaigns or trying to pull anything Part D. If people want to make a call, like, let us do it and let us navigate that for the member. So it's just been taking a skill set that we had and really making it marketable across other business areas to help them and support them. And we've had so many positive experiences and feedback from that. that it's just going to continue to grow so we can collaborate. And we've built that trust amongst our peers that are making these calls all the time.
That's amazing. And, when you said, let's get the member when they call in and make sure we can take action right at that moment, it sounds so logical, but we all know how difficult that can be, especially within a health plan where there's silos and different groups. And so it's really something that you've been able to kind of do this and create a framework that's repeatable now across different parts of your organization. So that's fantastic. Mara, do you want to talk a little bit as well about your experience kind of in the same realm?
Sure, thank you. So Oscar has a very strong focus on the member experience. Our customer satisfaction rating, our net promoter score, is 3 times higher than average for health coverage companies. We have an NPS, a 66 NPS, and the industry average is 12. So we're doing something right in making members feel engaged and heard. And so while we work with a PBM partner, we retain control over those elements that really shape the member experience. They receive support from Oscar's care guides. We independently manage and maintain that formulary, as well as overseeing our clinical utilization management and prior auth decisions and processes. We've moved away from typical things that, like when you're working with a PBM partner, and some of the communications that might come from the PBM versus what comes from the health plan. And we really are trying to focus on making sure that those communications are Oscar branded and in many cases actually come through Oscar. We have a lot of digital engagements and we have digital engagement tools with those members in how they prefer to be engaged with us. And so we try and make sure that we're taking those into account in how we communicate with the members. We're also looking at other ways that we can identify opportunities where you reduce friction with what's happening with the member and how they're being supported. And you can't, as much as we'd all like to say, you can blind that PBM to a pretty far degree, but there are places where they're going to see that. And so we're continuing to work with our PBM partner on how do we improve some of those, particularly when you think about the specialty pharmacy experience. And a lot of times the specialty pharmacy experience looks and feels like the specialty pharmacy. And how do you make sure that you actually, the member understands who that partner is and where are the lines, setting very clear lines with our partners on what comms do I want you to make? When is it more appropriate for you to outreach to a member versus when am I taking the point and leading the charge? And so that there's no question and you don't have any of that duplication. Because the thing when you're a health plan that any vendor partner that you're working with is never going to know is everything that you know about the member, because you have their total care in front of you. And so if case management is already working with someone, if they're already engaged in, working with your care team. And so making sure that we always are very clear in everything that we're doing, who owns the lead on that comm, and making sure that partners know. Really, it's more like we tell you when to comm, otherwise assume we're in charge. So that way you can avoid some of that confusion for members.
That's so important, Mara. And I want to make sure I call it out again, because that sort of concept of really communications governance, if you will, is such an important one. And it's one that we talk about with our clients all the time. And sometimes actually have to go in and set up communications governance for our clients, because it shouldn't be discounted, right? So many payers struggle to understand all the different communications that members are being hit with between just their own internal departments and those delegated vendors, right? And so having a good understanding of exactly what outreach is going out and who it's going out to and the cadence is really important. And trying to work towards branding those in an organized way is great. So thank you for that. Before I jump to our next question, actually, I'm going to take a quick poll. Let's get our audience involved a little bit here. So you should see a polling question popping up now in your browser, and we'd love to hear your feedback here. The question really is, can you please indicate which of the following initiatives you're seeing put in place to increase pharmacy orchestration today? So everything we just sort of talked about with our panelists, we would love to hear from you about what you might be doing now, following along kind of the same lines. And please do all that apply. So is it pharmacy collaborating more with your stars, your HEDIS teams, more with condition or care managers, more maybe with your member experience or CX teams, or frankly, are you just not seeing much collaboration at all? So that may that may be the case here. But we'd love to hear from you because again, you're seeing just with what we just heard from both of our panelists, two very different approaches, two very different types of plans, but really working towards that orchestration in an organized way. And so we've got some results back, and it looks like 40% of you who have responded definitely have pharmacy collaborating more closely with member experience or CX teams. So that's great. So certainly understanding that now maybe more than ever, understanding your members' experience with the plan is critical. And then almost as many, 36%, have said that pharmacy collaborating more closely with Medicare Stars and HEDIS teams is happening, or you're seeing that. And frankly, followed not too far behind are both tied here at pharmacy collaborating more with condition management and care managers. And then another 24% saying they're just not seeing collaboration today. So we appreciate the transparency and the honesty there. And the good news is there's plenty of time and plenty of opportunity to do so. And hopefully you're going to hear some things on today's call that will resonate and that you will want to bring back to your teams. So that's great. So with that, I am going to come to another question here for our panel. So for both panelists, what are some innovative solutions that you have found for cutting through the noise? And so we're back to communications again. Your members are getting inundated all the time, not just from their health plan, but from the world in general. How have you been able to cut through the noise effectively and try to get some of your more non-adherent members to actually engage and become more adherent? And Melinda, we'll start with you.
Sure. Thank you, Melissa. So, I think the key to this piece of it is that fatigue from the communications in general and understanding that in context to what being fully delegated to the PBM, when and where are they getting those outreaches. So once we've figured out where those pieces are, it really gave us that opportunity to then think about how we can then segment our membership into these different categories and how and when we do that outreach. So looking at the pilot that we did and the feedback we were getting and saying there's key themes here amongst our non-adherent members, and how can we make messages specifically tailored to them within their journey throughout the year to prompt action and give that call to action, and being very thoughtful around how we're creating those letters to make them pop and to really sort of stand out from what we would have either sent or what the PBM sending. And doing a little bit more on the electronic side, which that's kind of what we're getting there for like text and email and stuff like that. So trying to think more about how we can do that. And, we just actually did our first round of this and sending an email with 2 specific segments, and it dropped April 3rd. By, it's the 16th now, but by the time it went out, we have seen 36% of the members that received that email have already filled a medication based on just that one email communication we've sent. And so the timing of doing it this time of year, and then again, having that contact information funnel directly into the Medicare clinical program team, they're getting something they've never seen before, and they're getting warming letters, and they're really it's setting apart from just cold calling and like at one point in time in the year. It's that journey that we're pulling through. And then again, MyMeds really helps with that to get us on the right track, so that we're reaching out to those members at the right time. So that way we're not leaving anybody on the table, so we can make those conversions earlier in the year, and then being able to address those barriers. So when we're making a second or third call, or we're sending something else, we already know that they've flagged XYZ as a barrier. So we're not reinventing the wheel, and the members feel heard, right? So it's not just asking the same questions, like, is this still the same barrier? Would you like us to help call here? So really getting that full view of it. And then again, with MyMeds, we can also time it that if we sent out a letter and they, we have this happen, they fill it, but then it goes back onto the shelf because they don't pick it up. Eventually they're going to show back up in our queue again. So then we can say, all right, how do we want to then approach them again this time, and how we can time that? It's just that overall customization is giving us the ability to show up for members differently. And we're seeing members wanting to call us, and they're calling us. So we're not even having to break through the noise because they're initiating that contact. And we think that's going to be the differentiator this year for us, is establishing that connection with us and having them know that we're their ally and their trusted partner in the process.
That's great, because I think what you're almost describing is that through really valuable communications, you've almost trained the member to realize, hey, everything I'm getting from them means something to me. It's a really valuable communication piece now, and it's one that I want to read or open or whatever the case may be, because it's going to have some great impact on me. And maybe that means I actually should reach out proactively and really take a more active role in my own health, which is fantastic. I also think you hit on something really important around barrier breaking. Barrier breaking tips should never be discounted, right? How do you turn a no into a yes when it comes to a refill? How do you really hone in and make sure you understand, okay, to your point, let's not keep going back to the same barrier. Let's make sure we address that barrier proactively. And if the barrier is transportation and I can't get to the pharmacy because I don't have transportation to pick up that medication, let's work around that. Let's find an answer for them so they know how to get that medication that they need. So that's great. Thank you, Melinda. And Mara, same question. Maybe talk a little bit about what you're doing.
Thank you. So when we look at our, how do we reach out to members? How do we communicate? Again, being a very tech forward company, Oscar actually developed our platform called Campaign Builder. It's actually a tool. It's actually a tool that Oscar actually can be purchased in the marketplace. And so we actually have partners at facilities and at large systems that have also purchased this tool. So it's a standalone tool that we developed initially for ourselves that is a communication and automation platform that's tailor-made to help innovative healthcare organizations achieve better clinical and business outcomes. And so it's very tailorable to say, what are the scenarios? What kind of communication? How am I going to track that communication? And so it's the core of the platform that we use and how we actually can reach out to members in the way that they want to be reached out to. Do they prefer mail? Does somebody want a phone call? Are they digitally engaged with us? And so through digital engagement, you actually get a lot, because if somebody's already digital engaged, then there are messages and ways that you can connect with them through the app. We also use secure text messaging in cases as well, but we have looked to say, what are some of the barriers? And so barrier breaking could be what you're referencing in, how do you make sure they have access to that care? Is it a transportation issue? Are they in a pharmacy desert? Are they in a rural area and they need to understand what's around them, or who delivers and how to obtain those delivery services? So there's some of those things, but we also look at it in being able to say, what's preventing you from engaging with us? And so sometimes we love to think oh, digital engagement, that's the way to go, and let's get people out there, but that's not how everyone wants to be communicated to. And so, we've taken a look also and making sure, and this is where the Campaign Builder tool has really helped us in understanding when we do one of these campaigns, we also try and get some insight as to what was the barrier in somebody using them. And sometimes it was they want to be engaged with us, they want to get that secure message potentially, but they don't actually want to have to create a whole profile, and they don't necessarily want to use the app all the time. So it's making sure these preconceived notions of how somebody wants to be digitally engaged, that you have to have different pathways, you have to iterate. We're doing a pilot right now with being able to make sure that members know what are those other services and what organizations in those areas can help them if you're somebody who's struggling to get your groceries or struggling to pay certain bills. So we understand that sometimes what keeps you from actually seeking that healthcare, particularly with prescriptions and med adherence, sometimes is the money. And so I'll talk a little bit about some of that else in one of the later discussions, but that's also where we've said, how can we connect you with other services that maybe help free up and help you to actually solve some of the other issues? Because you're basically deciding, do I stay adherent on this medication, or do I fill my pantry? Or do I put diapers on my child? And so and making sure that we're thinking about those other things that our individual members need access to as well.
So important what you're talking about, to understand, other barriers, non-clinical barriers to getting care or getting those prescriptions picked up. Another piece I just want to mention, Mara, that you definitely spoke about, and I just want to highlight again, is that idea of collecting your members' preferences, right? Not just their preferences for what channel do they want to be communicated in, but really understanding them and their profile. Where are you maintaining that information? Are you collecting opt-outs of where they, do they not want to be communicated by text messaging, for example, but they do prefer email now? Being able to collect all that information, keep it in a single location, keep it current, and manage it so that you can have really optimized digital outreach is so critical. And it's something we talk with our clients about a lot. And it sounds like you've mastered that. So that's fantastic. Before we move to the next question, I want to take one more second and final poll of our audience, because I think what we're talking about here with the panel is so interesting. And I'd love to hear from all of you as well. So what innovative communications outreach have all of you seen used in pharmacy today that has driven desired results? So whatever your desired outcomes are, if you are seeing some of these innovations being used, we'd love to have you check off all that apply. Are you using behavioral science techniques? A lot of those, I'd say, are things that we often see used outside of healthcare today, but not always frequently within healthcare. Amazon is always my favorite go-to. Everyone goes on to Amazon and they want to go buy the water bottle and it says there are 3 left, and they're using that scarcity behavioral science tactic. They use it all the time because it works so well, right? There's all different tactics in behavioral science that could be used, that in other industries use, that healthcare doesn't always use. But are you seeing some of that used? Data and analytics to maybe personalize the outreach, those barrier breaking tips we heard about, more of an omni-channel approach. I love both panelists talking about using multiple channels. Melinda talked about using a warming letter maybe before you send an email or a text. That really can make a difference. And then even folks using maybe CDPs or customer data platforms to manage that member and patient data more effectively. So love to hear from all of you if you are using some of that today and what you might be seeing success with. And hopefully most of our panelists have voted now and we're able to see some of those results. Great. So it looks like far and away, 2 are sort of tied as number 1, which is using data and analytics to personalize outreach, which is great, and an omni-channel approach, which is terrific. So those 2 are almost 60% for both responses. After that, we're seeing about 25% are using some kind of CDP, customer data platform today, to manage that information. I do know from a lot of the work that we do with our clients that can be tricky, and many payers are currently evaluating different CDPs out there to decide, how do I manage all of this information and keep it current? So not surprising there that that's a smaller percentage. And then in sort of the final piece here, we're seeing barrier breaking tips and behavioral science techniques, only 17% for both of those. So definitely not as widely used at all. Again, not as surprising. It's 2 things that have been used in other industries for decades, but are still, unfortunately, a little bit new to the healthcare space, but very easy to get started with and very easy to use. So I'm glad we're talking about that in a little bit more detail today. I'm going to move back to our questions now. And Mara, this one is directly for you, actually, because Oscar is a different plan from Blue of Mass. I wanted to ask you, we all know, and I think you highlighted earlier, that the specialty medication experience is much more complex and expensive. How have you at Oscar successfully used technology to better manage maybe the members' expectations and the overall specialty costs? And are you utilizing tech to improve communication and the overall experience for members as it relates to specialty?
Yeah, thank you. So, we recognize specialty drugs are pricey. And so I'll just share, this sort of gets to all the things that you're saying about how we use tech, how we use data and information that we have to help identify opportunities to help members offset that burden of the cost share. So they all, specialty drugs often have those larger cost shares associated with them for members. And, I think we're all familiar, there's many companies that are offering copay assistance cards to help lower the copay for certain meds. And table stakes, any specialty pharmacy is going to be trying to identify those opportunities. But, there are times where something's missed, or you just don't get engagement from the member for various reasons. So one thing that we actually did was, again, I talk about our campaign builder tool a lot, but it's the combination of our data science and analytics, and then the ability to unleash spin up a very quick campaign through this tool. So we actually partnered with our specialty pharmacy, and we used our campaign builder tool to link members to that cost assistance. So we did our own data analytics and actually looked to see where we knew like copays, these assistants were being used. We also worked with our pharmacy partner to understand where were they not getting traction, even though they had outreach to a member, because again, you don't want to outreach to somebody without acknowledging that somebody's already contacted them. And so we wanted to make sure we understood that. And we used our tool to actually very successfully help these members understand how to get access, what to do, connect them with the right person so that they could use these. And if they didn't immediately opt in, we did some follow-up. And so we know this can be the difference between members getting the care they need or avoiding care. And so this really lowers that barrier for members to get access. I'll also just share one of the interesting feedback points that we got from some members as to why they were not wanting to engage was, I actually can afford this cost burden. I can afford this cost share, and I want to leave the dollars for somebody who really needs it. And so educating that individuals that, by the way, it's unlikely that this one person accessing this program is going to take away from someone who needs it. There are needs-based programs, and making sure that members understood that many of these copay assistance programs are very different than needs-based programs. And so that was one observation that really surprised us in this. And it was a very successful, and it really builds all of that of like core things that we were already doing that everybody does, but finding a way to actually optimize that and using our tech and our ways to engage with members.
It's so insightful what you just mentioned. And doesn't that insight that you heard really point to education, right? Just understanding people understand, well, you get this benefit and here's how it works. And we want you to use it, and you shouldn't feel bad about it, because we do a lot of panelists and focus groups with consumers to get the voice of the consumer. And we have heard the same feedback actually along the same vein as it relates to transportation, for example. In a recent panel just a week or two ago, we heard someone say, I'd like to use the transportation, but I feel a little guilty about it because I feel like maybe I don't really need it and someone else probably could use it more than me. And so we sometimes underestimate that feeling that members can have, and it really just points to the more clear need to educate on how those benefits work for people so they do use them and they do get the care and the prescriptions that they need. So that's great. So a question now for you, Melinda, specifically, totally switching gears here a little bit, but I know Medicare has introduced a lot of changes with the Inflation Reduction Act. How has the IRA really impacted your member population and your overall approach at Blue of Mass? And what techniques are you employing with your members to address these changes that are coming out of the Inflation Reduction Act?
No, great question, because it actually segues really nicely into what Mara just said. It's education, right? I feel like it's different concepts, but at the core, the same thing. So it's the education component. So this year, a few things happened with the IRA that were beneficial for the member, which included the elimination of the coverage gap, the out-of-pocket cap change, as well as the Medicare payment program. So there were things that were making medications more affordable in the Part D space. So I think the question for us was, thinking about what we're hearing from members regarding cost concerns, and then thinking about those barrier breaking messages, that it kind of goes hand in hand. And then also, how do you change those barrier breaking messages? Because now there are things to costs that aren't as critical as they were in years past. It makes things more accessible for members. So it really was around ensuring, obviously, all our regulatory requirements are in place, that we're implementing and operating these changes under, the expectations of CMS, and thinking about what are these components and things that are going to be confusing to members, because I don't think there are things that members are naturally going to think of. So trying to give thinking about it up front, what members might have questions about or thinking about. So working with our business partners to give them talking points to be able to walk through all these items if someone has a question. And then what we're doing on the Medicare clinical program team is we're looking at the members' benefits and we're factoring all these components in before we make the phone call. If they're on drugs that are going to push them into the gap or have that out-of-pocket cap, and then have them not have any cost the rest of the year, how can we explain that so they know that they can fill their medications and it's not going to be as stressful throughout the year? So just try to really break down, because Part D is so complicated, like breaking down all those barriers that members think are there and try to walk through it. So a couple of examples, like a quick one I can think of that was actually from IRA last year is a member had their insulin and they didn't know it was the cap, but they were paying out of pocket completely, like direct from the pharmacy. They weren't using their benefits at all, but they had a drug early in that year that had already had them reach their out of pocket. So everything was $0. So the member thought they were saving money by buying it directly, but didn't realize by not utilizing their benefit at all, they could have got it at $0. So I was trying to explain that to the member. We're like, oh, we understand. Well, it's a $10 difference for you, but like actually, congratulations, it's $25 now. And we called and we set all that up. So it's listening to what the members' barriers are and their issues, and active listening, because they're not going to outright tell you like, oh, my out-of-pocket max is my barrier to this. It's I'm going and getting this, direct from here. And I'm not using my insurance. And it's like, well, and now in these instances, if you have high cost drugs, you should be using your insurance because they're going to be covered at a different cost than they might have been last year. So another one we had similarly was a member was taking an injectable medication, a specialty, and it was expensive, and they just stopped. They had to discontinue it, but they had a lot of symptoms still. So they called and they got connected through a referral. And we were able to walk them through the scenarios, give him some ideas about what he could ask his doctor for, what to ask, what that cost would look like, what that cost would map out for the rest of the year, get him connected to M3P, all the different things that just allow for a member to have access. So they understand it. And like, again, we want them to use their benefits and understand the benefits, but not and make it less scary. So like the active listening is so important. And we're prepared when members are calling to be able to address these things and just really reinforcing that educational piece, because it's complicated to navigate on your own.
It is super complicated. I love those anecdotal stories. They're super powerful, right? Because that's where you have changed someone's life. I mean, being able to get their insulin at a way lower cost is really going to impact their overall health in the long term. And I think you really hit on it. You need to be able to coordinate that and then take action right away. So it's that active listening you described, but also being able to take action on it, which is so important. So thank you for that, Melinda. So that concludes our formal questions to the panel. This has been a dynamic conversation. Thank you both so much. Let's get the audience a little more involved again now. Finally, everyone in the audience, if you haven't already, please drop your questions in the Q&A box, and we will do our best to answer as many of those questions live now as we can. If we do run short on time, we can answer any questions after today's call, and we can return them to you when we send the link for the video replay. But please feel free to drop those in now. And I will start with one for the panel here. So someone has asked, can you please discuss your member engagement tool experiences? In other words, member portals versus a mobile app versus two-way texting with embedded links. So I will turn that over to whichever one of you would like to take that one first.
I'm happy to start, Melinda. So I think I touched on this a little bit in the answer to some of the questions. all of the above, right? So I think it's important that you need to think about how are you engaging members? What is the member experience, and how do members want to be engaged? So you can't just say, well, we have a member portal, and you need to make sure. I would say that anything that you have, that if you've got any sort of portal, it has to also be an app engagement. People are often, particularly, and this might be where Melinda and I have a little bit different experiences, although I would argue that many people say our Medicare population doesn't use tech. But I will tell you, my father in his 80s will tell you, you will pry his iPhone out of his cold dead fingers, and is very much digitally engaged. And, there are only certain places where he still prefers to talk to a human. So I think that making sure you know that, right? And so, like, we've made a lot of assumptions about people. People will assume, oh, Oscar members want to be more engaged in this way because they tend to be younger because you're in the ACA. That's not always true. You do have members who want to use a portal. They want to actually log into something on a website. You do have members who actually want an app on their phone. You do have members who want to actually use texting as a way to calm, but some people just want to call you. And so, you also need to make sure that you've got ways for them when they call you to get to the right place and the right individual. So you need to think about member engagement very holistically in what is the member engaging with you for, and what are they seeking, and then how are they going to seek that information, and make sure that you have a variety of ways, and don't assume you got to leave your biases at the table, and how you think different individuals are going to want to engage as well.
Yeah, that is absolutely on track with what we know and hear all the time at Engages. So that completely makes sense. Melinda, anything that you would like to add to that one?
Mara, I agree with the, assumption around the Medicare population. I think we are seeing that they want more digital tools, and they want to be able to interact, and they want to be able to, not always pick up the phone. So, our plans on this are still, we're still building them, and like we want to get there too. So I just think with all the CMS requirements that have there, and the legal components of it, just we're mapping all those pieces out to make sure that, we're doing everything, correctly and compliantly. But it absolutely is the future. It's just going to grow, and the need for it is going to grow because, all your other, services that you use outside your health plan have these types of things. People are going to want it. So I think it's a little bit longer term for us, but it's on the radar to increase all those components and what we can do, and how we can bring that, whether it's with tools that we have internally, or if there are vendors we need to help support that. Like, we're still in the vetting process of a lot of that.
And if I could just add, Melissa, I think to this, Melinda said something that sparked for me is right. We are also very bound by CMS requirements and state, right? And you are as well, right? In when do I actually have to send a letter? What actually has to be on that letter? And so in a lot of ways, they're very prescriptive. So sometimes you also have to look and say, I need to still meet the regulation, and I'm going to send the letter, and I'm going to send like what I need to send, but how well, but we also know a lot of time, if that's not how somebody connects with you, they're probably going to toss that, or they're not going to fully understand it. I know that, our regulators try and give us guidance in how those comms are, with the intent that they are in easily understandable language. But the reality is they are not necessarily in the language or the messaging that the member needs. And so sometimes you have to couple both of those approaches with what the regulators tell you to do, but what you want to do. And then the other thing I would just add is you also need to be mindful as to your population. So I think everybody thinks about, like, we have requirements to have comms in different languages. But if you are servicing a Spanish first speaking population, we have Hola Oscar and we have Bueno Salud products that really target Spanish first populations. And what we've learned, and why we did that, is when you think about these communications and when you think about them in another language, you can't just translate them. You also have to think about how does that that population, how does that segmentation, what messages actually resonate with them? So sometimes in the way your engagement tool experiences are, also have to think about segmentation and how those populations, not just based by age bands, but also geographical and also ethnicity and how they want to engage. So you really need to think about all of that when you're thinking about your member engagement tools in how you put them together.
Absolutely. And an important highlight for sure. Thank you, Mara. I want to thank you both, thank our panel, both Mara and Melinda, for sharing your expertise and your insights on what's working in the real world today within payer pharmacy areas and how you're achieving some measurably improved consumer engagement and outcomes. Everyone here today is welcome to reach out to any of us. You can see our contact information is available now here on the screen. We would love to continue this important conversation. All of us would love to hear from you. And Jenny, I will toss it back to you now. And I just want to say thanks to NCPDP for the opportunity to share this information with all of you as well today. And the hard work of the Health Plan Subcommittee. And then, of course, our amazing panel and all their effort that was put in today. Thank you.
Yes, I echo that. Thank you, Melissa, Mara, and Melinda, for sharing your wisdom and your experience and truly valuable insights with all of us today. So thanks again to all of you for joining us. We hope that you leave today's session armed with some more tools to take back into your respective organization and help achieve some of your consumer healthcare engagement goals. A friendly reminder, as Melissa mentioned at the beginning of the call, that there will be a link and a recording provided within 5 days. And lastly, I would be remiss if I didn't kind of do a shameless plug to say if this topic or others are near and dear to your heart, NCPDP would love to have you get engaged, especially if you're a subject matter expert in this area and interested in helping our subcommittee work continue to move forward. So please feel free, there's an email address on the screen, take a note of that and reach out and see about how you can get some more information to get involved. And with that, that concludes today's NCPDP webinar. So thank you all for being here today and have a great week.